All right, we're going to prepare the interocclusal recording material. What we use for this particular step is Beauty Pink Extra Hard Wax made by Moico. This is tempered in a hot water bath preset at 140 degrees. We first soften the wax, then fold it on its end, and then cut it to the approximate size of the dental arch. We want to cut it in somewhat of the shape of the arch as well, and we will also allow room for the leaf gauge or any anterior deprogrammer to be able to be used in this step. Again, the anterior area is relieved. Once it is cut, it's positioned in this manner. This will allow a positioning of the interocclusal record deprogramming device to be able to be used, as you see the leaf gauge in place here. Again, this can also be used with an anterior deprogrammer.
To help the patient achieve a centric relation position, use an anterior deprogramming device such as a leaf gauge. Place the leaf gauge between the maxillary mandibular incisors. Instruct the patient to protrude and then retrude the mandible while closing on the leaf gauge. The retrusion should be until the mandible stops on its own. Do not force the mandible back. Additional leaves are required if posterior contacts are present. Ideal disclusion is 0.5 millimeters in the posterior region. This cycle should be repeated to verify that posterior disclusion is maintained.
What we're going to do next, I'm going to soften this wax. It's a very specific type of wax. And I'm going to get it nice and soft in a hot water bath.
Remove the leaf gauge and place the softened wax into the mouth. Next, place the leaf gauge between the teeth and through the pre-cut slot. Instruct the patient to close on the registration wax and then protrude and retrude, then squeeze lightly together. To ensure the material is set, chill the wax with air.
Continue to hold together. Now just barely open, close, barely open, close, open all the way now. Stay open there for us. Relax. Open for me. On your back teeth, close, squeeze, slide your jaw forward slightly and back. Hold right there. Okay, we're going to check, make sure your jaw's in the right position again here. Hold right together with that. You feel a little pressure. You shouldn't feel any pain. All right, now we're going to chill the wax here with a little bit of air. Okay, Lauren, I want to check to see where your first tooth is touching here. There's going to be a tooth touch somewhere in your mouth first before the others with your jaw joint hinged like this. So what I'm going to do is take away a few of the leaves on the leaf gauge here until we find that first point of contact. Okay? Okay. Now, I need for you to open here for me slightly, a little bit more. I want you to stay open like that. Don't let anything close. Let's decrease it down to about 10 leaves here. Okay, now close for me again. Slide forward and back. Feel any teeth contacting there at all? No. Okay, open here for me. Stay open just like that. Okay, close. Slide forward and back. Feel any teeth contacting now?
All right, back on.
Back here on this back right side?
Yes.
Okay, good. Let's check that. Okay, Holly, if you'll take the leaf gauge there. Open for me a little bit here. Pull your tongue back a little bit. Close for me.
Slide forward and back. Okay, that's the contact that we were looking for. Okay, open for me here. Take the cheek retractor out here. Go ahead and put the leaf gauge in for us, please. Close, slide forward and back. Okay, I'm going to have you just barely open. You should feel that tooth touch in just a second. Open slightly for me. Feel that tooth touching?
Mm-hmm.
Just hold right there. Open just slightly. Just let your jaw relax now. And just close to your first touch. Feel it touching right there. Mm-hmm. Hold there. And close on down. Okay, so you have a little bit of a slide there. All right, relax your jaw.